My name is Rusell Hawkins. I'm a Professor of Psychology with James Cook University and with the Mount Isa Centre for Rural and Remote Health. I'd like to very briefly describe some aspects of the mental health project that we are operating here at MICRRH. We've got a few objectives with this project, and I will very briefly itemise these objectives. The first one is to work to increase community access to mental health services, and this is challenging because there are various barriers to people seeking mental health services. Some of these barriers are associated with issues to do with stigma, some are to do with lack of awareness of existing services, and then there are more practical barriers like cost and time. So part of our work is intended to address these barriers. The second thing that we need to do is to ensure that health professionals are better equipped to recognise mental health problems, and that requires improved training, access to expertise and professional development. So here we're developing work to bring in speakers as required and trainers, and to make sure that existing health professionals have improved opportunities for their professional development. The third thing that we want to do is to engage with the local community to increase awareness about mental health issues. Awareness does seem to be increasing. There's improved recognition, for example, of the significant problem posed by suicide in rural and remote areas. Suicide is a major killer of young males in particular, females too, but young males in particular. And we're doing various things to improve awareness of the size and extent of mental health problems. The last thing that we are wanting to do is to improve and create greater clinical training capacity. There are some difficulties because it really comes down to getting people to come to rural and remote areas from the coast, from the cities, from the larger towns. We're doing some things about that, which include setting up some scholarship opportunities for people and trying to make Mount Isa a good centre, not only Mount Isa, but starting with Mount Isa, a good centre for people to come and spend some time. These people might be clinical psychology students or mental health nurses or social workers. So that's a very, very brief overview of where we're going with mental health here at MICRRH. Thank you for having a look at this.